Okay, let's talk about the knee for a minute. Have you ever really stopped to think about it? We use it for absolutely everything, walking, running, squatting, but we almost never appreciate what a masterpiece of biological engineering it actually is. Seriously, it's not just some simple hinge. It's this brilliant collection of solutions to some really tricky problems. So let's dive in and take a closer look at how this incredible joint really works.
So, when you look at an x-ray of the knee, it seems pretty straightforward, right? You've just got one bone sitting on top of another, but honestly, this simple image is hiding an incredible story, a story of how our bodies evolved to give us this amazing combination of rock-solid stability, mind-bending flexibility, and raw power.
And that really brings us to the central puzzle we're going to unpack here. How on earth does this one single joint manage to do two completely opposite things so well? How can it be this stable pillar when we're just standing around, but then completely transform into this super dynamic joint that lets us do deep, fluid movements like a squat? Well, the answer lies in some truly elegant design secrets.
So to unpack those secrets, here's our game plan. We'll start at the top with the femur and its clever balancing act. Then we're going to check out the tibia's built-in ramp. After that, we'll get into the patella's awesome pulley system. And finally, we'll see how it all comes together in this beautiful symphony of movement.
All right, let's kick thigh off at the top with our thigh bone, the femur. It has to solve a pretty fundamental problem that actually starts all the way up at our hips.
Okay, so here's the core challenge for the knee's design. Think about it. Our hips are wider than our knees, right? So our thigh bones, our femurs, don't go straight down. They actually angle inward. Now, if the two little knuckles at the bottom, we call them condyles, were the exact same size, our knees would be tilted and just wildly unstable. So what's the body's fix? It's brilliant. It just makes the inner knuckle, the medial condyle, a little bit longer. And it is such an elegant solution. That tiny little difference in length, it perfectly compensates for the femur's angle, and boom, you get a perfectly level horizontal surface for the joint. This is the absolute foundation of the knee's stability. It really all starts right here.
But hey, stability is only half the story. A lot of people think the knee is just a simple hinge, like you'd find on a door. But if that were true, our range of motion would be, well, pretty terrible. The femur shape is way smarter than just a simple circle.
These femoral condyles, they actually have what's called an eccentric curve. That just means the radius of the curve changes, and each part has a very specific job. So the back part has this really tight, sharp curve. That's what lets the knee roll back and get into a deep squat. Then the middle part is much flatter. That's what gives us that wide, stable surface for standing. And finally, the front has a nice, gentle curve that creates a perfect little track for the kneecap to slide in. So cool. 3 different surfaces, 3 different jobs.
But of course, the femur isn't working in isolation. It has a partner in this dance, the tibia, our shin bone. And the tibia has its own really remarkable feature that helps enable that deep bending we were just talking about.
This feature is called the posterior tibial slope. And what that means is the top surface of the tibia isn't flat at all. It actually slopes down toward the back. Honestly, the best way to picture it is like a little ski slope built right into the bone.
And that downward angle is absolutely key. So imagine the round ends of the femur, the condyles, are like a pair of wheels. As you bend your knee, this built-in ramp actively encourages those wheels to just roll backward, smoothly and efficiently.
So what's the big deal here? Well, this ski slope is basically what makes a deep squat possible. Without it, the femur would literally crash into the back of the tibia and your motion would just stop. This slope promotes what's called femoral rollback. It gets the femur to move back and out of the way, which opens up space for the knee to bend deeply, and it does all this while reducing stress on the joint. It's fantastic.
Okay, so we've covered the 2 main bones, but what about that little floating bone right at the front? Yeah, the kneecap, or patella. It isn't just some protective shield, it's the heart of an absolutely ingenious pulley system that dramatically boosts the power of our legs.
So here's the problem the patella was built to solve. Our massive quadriceps muscle, right? It pulls at an angle. It pulls upward and outward. Now, if that force went directly to our shin bone, it would be really inefficient and would probably try to yank the joint sideways. But the patella, sitting perfectly in that groove on the femur, acts like a pulley. It takes that angled pull and redirects it into a perfectly straight, super powerful force to extend the leg. And get this, the system even has a built-in safety feature. The outer wall of that groove on the femur, the lateral femoral condyle, is actually higher than the inner wall. This creates a kind of bony wall, a buttress, that physically stops the patella from getting pulled sideways and dislocating. It's a hugely important stabilizing feature.
Now, this pulley system has to deal with some absolutely incredible forces. I mean, just when you stand up from a squat, the compressive force on the back of your kneecap can be anywhere from 3 to 8 times your entire body weight. Think about that.
So how does the body handle that kind of pressure? With yet another brilliant adaptation. The cartilage on the back of the patella is the thickest cartilage in the entire human body. We're talking 4 to 5 millimeters thick. It is the ultimate shock absorber, built to handle a lifetime of those massive forces.
All right, so we've looked at the individual parts, the leveled femur, the tibial ski slope, the patellar pulley. But the real magic, the real genius, is when they all move together. And that adds one final, beautiful layer of complexity: rotation.
You see, the movement isn't just a simple bend and straighten. No, there's this incredibly sophisticated rotational dance going on. The femur and the patella are actually rotating in opposite directions to each other. This is what keeps the femoral condyles constantly braced against the patella, guaranteeing stability through the entire range of motion. It really is a beautiful system to watch in action. So when the femur rotates out, the tibia and patella rotate in, and when the femur rotates in, they rotate out. It's this constant, opposing rotation that fine-tunes every single movement and locks everything securely into place. It's truly a symphony.
So let's just quickly recap the knee's incredible design secrets. We've got asymmetrical condyles to create a level joint from an angled bone. We have an eccentric curve for both stability and deep flexion. There's a built-in tibial ski slope to enable deep bending. It uses the patella as a powerful pulley system to redirect muscle force, and it ties it all together with opposing rotations to fine-tune every single movement.
Every single one of these features is a remarkable solution to a really complex problem, and seeing them all work together in one joint is, well, it's just awe-inspiring. It kind of leaves you with a final thought, doesn't it? If this much brilliant engineering exists in just one joint, something we take for granted every single day, what other hidden marvels are just waiting to be discovered within our own bodies?